October is Audiology Awareness Month, a time set aside to raise awareness about the causes and prevention of noise-induced hearing loss. Approximately 26 million Americans between the ages of 20 and 69 have hearing loss caused by exposure to loud noises. And as many as 16% of teens have reported some hearing loss that could have been caused by loud noise, according to a 2010 report from the Centers for Disease Control and Prevention. Noise-induced hearing loss is permanent. It can build over time, but is preventable if you take precaution. Lower the volume. Set the volume on electronic devices to a level that allows you to still hear what's going on around you. Move away from the noise. Put some distance between you and the noise source to reduce the impact on your ears. Wear hearing protectors, such as earmuffs or earplugs, if you can't leave a noisy place. The earlier children with hearing loss start getting services, the more likely they are to reach their full potential. The audiology specialists at Lake Ear, Nose, Throat, and Facial Plastic Surgery explain how hearing loss in youth often presents.
For children to have hearing loss, the earlier we find out, the better it is, because it's a part of them. And it's not something new that they have to get used to. It's not something that all of a sudden they're made fun of. When we find a child that's in their early teens that has hearing loss, then they feel a little devastated. They're embarrassed. Something's wrong with them. They don't want people to know they have hearing aids, and a lot of times they will not wear them. And so we have to look at other means of trying to help them in the classroom. And we work with the school systems on educating them as to how they should amplify the classrooms for that child to do better. We test children of any age, and most of them pass their hearing screenings with no problems. If a child has hearing loss, then it could be a temporary condition that can be corrected through surgical procedures. Maybe they need to have tubes placed in their ears, and that usually can correct that, and then they're hearing fine and everything is going to work well for them when they go to school. For children who have more of a permanent hearing loss due to birth or some other illness that they may have had, then we will start talking to the parents about how we want to rehabilitate that by use of hearing aids, working with the school systems to make sure that there are speakers set up in the classroom so that the child can hear the teacher and not have distracting noises. Most of the time when a child has hearing loss that's associated with ear infections, it can be easily corrected. We see children that have tubes. We see children that sometimes have to have 3 or 4 sets of tubes. Occasionally there might be some scar tissue from years and years of infection that goes untreated and really neglected, and then we can see a mild hearing loss that again can easily overcome through amplification.
You can find more information on the hearing and audiology services available at Lake Ear, Nose, Throat, and Facial Plastic Surgery when you click on the Audiology Awareness Month StoryLink icon on our homepage at yourhometownhealth.com.